went to the doctor. From that MRI, they could tell that my bone marrow was not normal for someone who was 37 years old. And they did a few more tests, and they came back and said it was chronic myeloid leukemia. My name is Mel Mann, and I live in Atlanta, Georgia. I was diagnosed back in January of 1995. The prognosis was 3 years unless I had a bone marrow transplant. In fact, there was only about a 1% chance of me finding a donor. After about a year, I started clinical trials, and around the 3-year mark, basically all the treatments were not working. There was one that was close. I would be the first person to use that drug if it got approved to be used in humans. And this particular trial required that I come back every 3 months. And I did that for another 4 years. I started on the medication, and it started working. It was the first month I would go in every other day. And I had to keep a diary, a handwritten diary, to talk about my side effects. And I actually had to find an apartment because I had to live out there for 3 months, and I was not reimbursed for anything. That's the only way you could do a clinical trial back then, is that you had to be on site, travel and parking and food and whatever. So I spent a lot of money on the clinical trial. Started the drug in August of 1998. And by June of 1999, I ran a 26.2 mile marathon in Alaska. When I did the pegylated interferon clinical trial, I elected to do a lot of it without going out to MD Anderson every 3 months. So they would send the drugs to me. They would have me go to a local doctor, have my blood drawn, and then I didn't have to travel, which was great. And then I could just look on through the portal and also just talk with the lady who was in charge of the clinical research. If I had any questions, I would just ask her. One thing about CML is that the testing technology has greatly improved. That works great with decentralized clinical trials. Get my blood taken at the hospital, and they got the results right back. Then I can talk with my doc. With cancer, you want to make those corrections as soon as you can. If they'd have the consent forms presented online, that would be good, because the participant will have more time to look at the consent form, or they could have a video of what a clinical trial is. I think that would be easier for most people, especially since we already went through the pandemic, that doing things online, that's the way to go. A lot of people are left out of clinical trials because they can't always operate within those hours that are normal for a practice. If it's online, you can do stuff at any time of the day. I feel that technology in clinical trials is critical, because first of all, you're going to have more people join clinical trials because they don't have to travel as far. You have people in the rural communities, you're including them. But for the patient, it's a game changer. I just turned 66 about 6 months ago. It's been almost 29 years diagnosis. And my goal is actually to be diagnosed at 37 and make it to 87, 50 years on after diagnosis.